Let me introduce Dr. Eisenman. He is actually the director of the Public Health Disaster Center, but he is also the co-director of the Healthy Climate Solutions Center. So I hope we can combine these two and find solutions, and we'll hear from him. Thank you for being here.
Well, good afternoon. It's really great to see everybody live and in person. The work I'm going to talk about is work that I've done with Michael Jarrett, who's in the room, Jonathan Fielding, who's in the room, and Diana Gonzalez, who I don't see, Yu, our postdoc. This was funded by both Center for Healthy Climate Solutions as well as the Conrad Hilton Center, and also Sustainable LA Grand Challenge. So we had cobbled together a bunch of work, really actually just to get, this is really a work in progress talk in many ways. So let me set the stage here. The background, of course, is that even under the most optimistic scenarios put together around climate change mitigation, the RCP 2.6, which is an optimistic emissions scenario, even in that case, the bathtub of CO2 in the atmosphere has already filled to the point that by mid-century, and in the definition of the climate change world, mid-century starts in 18 years, in 2041. So, you know, in some of our children's, our young children's early adulthood, by then, as early as 2041, we're going to see 3 to 4 times the number of extreme heat events each year in Los Angeles. So global emissions reduction, even if done, is not going to prevent a significant harm to our population. And of course, the harms disproportionately occur to the at-risk populations that we're often worried about, the health inequities populations and environmental justice communities. So right now in California, putting together our priorities for spending and action is very much generated by social vulnerability indices. CalEnviro is one that's very well known to many of you in the room. There are several others. And these are usually census-level indices of social vulnerability, including demographics, health status, land and building infrastructure variables. And they sum up, or they're done in different ways to look at the social vulnerability in that census index. And while this is very important, it's really not enough. Because I told you, adaptation is required right now. People are dying right now from heat. So if you're a public health agency worker, which I hope some of our students will soon become, or you're an emergency manager, or a land use planner, or you're a mayor's office, you need to know right now, where do I allocate my new batch of cooling centers? Where do I start to prioritize dollars for resilience centers? Where are the communities getting harmed right now? Which is more than just their social vulnerability. All right, you come to our website. This is now on the Center for Healthy Climate Solutions website. And you'll see a map of California load up. It's kind of slow in normal circumstances, and I guess it's slower up here. And it's going to show us the excess rates of ER visits for heat and the excess numbers of ER visits for heat by county and by zip code. So I'm going to just do the rate for demonstration purposes. And the state loads up. And the first thing we see is actually at a rate level, the highest rates are in the northern counties, which is surprising to me, and I think to many people. And we don't exactly know why, though as we've looked deeper into this, I can give you some ideas. It has much to do probably with acclimatization, lack of air conditioning in homes, as well as the intersection with social vulnerability up there. But let's get down to now the county level, which I think is where the health planner is going to use it. So Los Angeles County's heat officer has done just this, what I'm doing right now. They go down click on Los Angeles. The county comes up. And we see, as it gets increasingly red, that the zip code is a higher rate. These are just qualitative at this point. Qualitative differences in where excess ER visits are occurring. This is using 10 years worth of data from the hospital, the HCI data set, formerly OSHPD. And what we can do is zoom in a little bit and compare. This computer is it's got a different kind of pad, right? Than my laptop. So let's compare two zip codes here. I'm going to compare Culver City with its neighbor, West Adams. And pressing the wrong button. Well, I'm having a little trouble with this pad, but what I would try to do is show you that these two zip codes, there we are, we're lighting up now, have very different rates. That the leafier, wealthier community of Culver City has 1.4 excess visits per 10,000 persons on an average extreme heat day, compared to the neighbor right next door getting the exact same heat or getting the exact same weather pattern of West Adams, which has 3.5 excess ER visits per 10,000 on its average heat day. So this is displaying to you just the bald excess rate differences, the disparities between two communities. And what we know then is, and I'm not going to try to do it on this computer because I'm already having fumbling problems with this. You could then take these social vulnerability indices like CalEnviroscreen, which we've put into this website, and overlay them. So you can then see the match and mismatch between social vulnerability and excess ER visits. So you can say to yourself, okay, this district in West Adams, we already identified West Adams zip code as a higher risk right now for extreme hospitalizations for extreme heat. Which census tracts in West Adams should we actually target? Because the zip code is not is too big really for action still. So I'm not going to try that up here, but believe me, you can do that. And we can triangulate the two data pieces here that way. So the audience for this is, as I said, local emergency planners. We have seen already this being used by the chief heat officer in Los Angeles, by the LA mayor's office around planning, and in other counties for similar purposes. For hospitals, they use the number pull-down menu, not the rate, to plan for their hospital surge. They look at their catchment area and which zip codes are sending patients to them the most. In our next step, we are applying for money right now to make a much more polished website, something that's on ArcGIS and much faster on your phone, that will use more sophisticated analysis methods so we can get spatially variant issues here, and to design this with our primary intended users at the table to make sure it's useful for them. Thank you very much.